On this podcast, you'll find interviews with high-performing, successful individuals in life sciences. On a weekly basis, we cover their proven methods, principles, strategies, and mindsets to implement new technologies that scale to meet the needs of people in our world.
So today on the Life Science Success Podcast, I get to welcome Dr. Elaine Hamm. Dr. Hamm, welcome.
Thank you. Happy to be here. Be in my room here now.
Right.
Always happy to be here.
That is the way this is done anymore. Yes. There are a few podcasts that you actually see in our space. I think Pharma's Almanac does a nice job where they interview people outside, oftentimes more than 6 feet apart, take the masks off, etc. Yeah, but most of them, I think, are done this way.
Yeah, love it.
So can you tell listeners just a little bit about yourself?
Yeah, so by day I run a drug development accelerator. And what that means is that I look for interesting new therapeutics that are in the preclinical stage and form companies around them and shepherd them through this really risky early stage of drug development and find the right investors and the right partners for them. And yeah, that's my day job. But then my night job is I also run a wine bar of all things.
Very nice. Maybe we'll get into talking about that a little bit later.
Perfect.
And so how do you typically find for the preclinical stage items, how do you typically locate those?
So in my previous life, I actually was in technology transfer at the University of Oklahoma. I have been in the technology university space for quite some time. And so I've been developing relationships over the last 10 years or so. And really, I have special areas of interest. So I just go and look for things, what are interesting publications and posters and conferences, and find them where they are in the labs. And that's a lot of it as well.
So you'll go and actually look at somebody's poster at a conference and then take them out and talk to them more about what it is that they're researching. That's
absolutely. Yeah. So if you've ever done a poster conference, and you'll know that there may be people lurking in the background that are interested in finding out a lot more and maybe making it a company.
So it's interesting. One of the international trips that I took, this goes back a ways with one of the previous companies that I worked for. I was in Japan, and so I was asked by one of the Japanese professors to proof her poster all ready for a conference. So it'd be nice to know that something beneficial happened out of that work. I don't know that's the case.
I always tell graduates from a company comes up to your poster, they're not there by accident for sure. So we definitely look for, even the startups, we look through all of those abstracts and go find things very specifically.
And so with these, I know that most universities have a technology transfer department now. Would most of these items potentially maybe even not be in the technology transfer department yet?
Hopefully they have at least had a conversation with the technology transfer office, because otherwise that abstract will end up being prior art and a public disclosure, which would be problematic for filing a patent. But yeah, a lot of them, I will find cool, interesting things and then go, hey, I need to go have a conversation with their technology transfer office and see what the status is. And hey, they may already be licensed out, which is great. Again, my whole goal is just to make sure that drugs get out in a real, tangible, and helpful way.
Okay. And how did you go from whatever you did in the past with the technology transfer office to Ascend BioVentures?
I have, whether I meant to or not, I've been circling the startup space for quite some time in various shapes and forms. In grad school, I got interested in technology transfer by accident. I created something that ended up having a patent filed on it, and that got my interest I got really interested in that concept of, if you can use business to help move things from your bench to other people's benches. And so that was my first sort of taste of it, and really loved that. And really the one thing that was commercializable out of my dissertation, which was like 500 pages with one sentence. What was interesting was finding that one little helpful, useful thing that ended up being the commercializable aspect. But I actually didn't immediately go into tech transfer. I went into being a bench scientist at a startup company. Actually, we had a larger partner. Astellas was our partner, and I was a protein chemist for this drug. We were working on a drug for Alzheimer's. But I really got sick of being at the bench a little bit, to be honest. I wanted to get back into that interesting side that I just dipped my toe into, which was how to use business to get science out, and went directly into tech transfer from there. And loved working in tech transfer. It is such an interesting, wide variety, skilled industry because the first day drinking from the fire hose, it was patents and contracts and science that wasn't even my area of expertise. I worked in a campus that we had everything from oil and gas and weather and radar and to drug development. So I had to really stretch my brain a lot, which was really fun. And then from there, I left the university to go work at a venture firm to start a university accelerator for them and also learn more about the investment side, because throughout my career, I really thought about what do I not know how to do. And what I understood the accelerator part, and I understood how do you pull university technologies out of the university. But the venture side, I definitely didn't have a clear understanding. I was a microbiologist. Our level of math and finance was C1, B1 equals C2, B2. I was like, okay, I need to understand what a pro forma is and a balance sheet. So I went to go work for the venture firm and also help them set up an accelerator program. But I really started missing the science that led me to science, which was microbiology and drug development, which was my roots. And so I had the opportunity to work for actually one of my clients when I was at the venture firm to work on an antibiotic drug specifically. But they actually were an accelerator too. So they had a portfolio of companies, and I got a lot of familiarity of how a drug accelerator works and how to manage a portfolio of companies, and then started my own.
Yeah, no, I do find it interesting because I think I think overall one of the things that you oftentimes will see is that one technology or one drug gets pulled out of a university.
Yeah.
And I've interviewed somebody in the past who had said, "Hey, look, I went out and licensed several of these things and then made several of them successful."
Yeah.
You also look through the drug life cycle and you see how many actually drop out in each one of the phases. I just walked a legal firm through this entire thing using the example of 100. So I said, if we started with 100, here's the 7 that would make it from 100.
Absolutely. And
normal averages, but
yeah, no, the accelerator I was with previously actually hit that statistic pretty well on the head. And we had 4 companies. Each of them had probably 2 programs. Only 1 company survived. And so that 1 out of 4 companies make it, we really hit that on the head. And we're still, one of the programs, I'm still managing that company. So I'm president of a hearing loss company called Otologic Pharmaceutics. And our clinical program is now in phase 2, and we have a large pharma partner. And we have a preclinical program that we're getting ready to partner out as well. But who knows if those are going to make it. So we at least made it as a company somewhat, but yeah, the drug development, I mean, you have startups, which is so risky. And then you have drug development, which is so risky. And it lowers the odds for sure.
Yeah, and I've not experienced this myself. So I've actually been much later in the process, typically, where things are already licensed. You don't normally know much about the base science that led to that point. So a lot of that early preclinical phase is new to me anyway. Yeah. And one of the things that's been said to me now that I do talk to more people that are in the preclinical phase is hopefully people don't screw up my drug development so that this does become a good drug at the end of the day, which I think is kind of an interesting thing as well. If you've dedicated your life, maybe you spent 5 or 10 years trying to get to this point, and now all of a sudden you're getting ready to hand off your baby. It's probably a pretty tough spot to be in.
Absolutely. That's one of the hardest parts. The hardest initial stages when you're looking at a new asset. You're not just looking at the science and the market and all of those things. You're also looking at who you're going to be working with, who you're partnering with. It's a relationship. And I've done companies where the scientist was like, all right, here you go and be fruitful. And then I had scientists that really wanted to be involved. And so you really have to make sure that you both have the same vision for sure. And obviously there's constraints that the industry just has. There's certain things that the market or that pharma wants to do versus what a bench scientist wants to do. But it's definitely, you have to make sure that the people you're working with share the same vision, because you're right, it is your baby. I completely get that.
Yeah. So the one key question I have for you is, I know you're in Oklahoma, and Oklahoma is a real biotech hub, I heard. I just would like to clarify what led you there and what kind of made you want to start to work in this area?
Yeah, you don't think of Oklahoma and think biotech hub, right? You think oil and gas, maybe tornadoes. We got both. Really, I pretty much grew up here in Oklahoma. So and I wanted to grow where I was planted. I really like the community. I love the state and I want to make it a better place. And one of those ways is affecting healthcare here. So I have tried to leave the state too and get other jobs elsewhere. I've interviewed everywhere and I just keep coming back here and I keep, finding new and really interesting opportunities and people that are willing to take that leap of faith with me. Starting an accelerator on your own here was actually probably a lot easier than starting an accelerator in San Diego or Boston. I'm a bigger fish in a smaller pond here. But we have some really great biotech companies here, and one of which, the hearing loss company, we've been moving along with that program and got some good partnerships there. But we had a company that sold to Novartis for $650 million a few years back. It's here. And we actually have Cytovance, a biologics manufacturing group here too. So you wouldn't think it, but it's here.
Yeah, I wouldn't think it, but at the same time, I'm not surprised. And I'm in Colorado, and as you drive around, I'm just amazed at how many biotech firms are here. There seems to be a significant draw as well for a lot of people that were in California before to come to Colorado. Now, who knows, maybe one day Oklahoma.
Yeah, the reverse of the grapes of wrath, for sure. Well, and Oklahoma we have oil and gas, and obviously that's here, but we also recognize the need to diversify. And so the people here have wanted to take an interest and wanted to invest in biotech here, which is really great.
Great. And it also, just to explore a little bit more your sort of journey from going from the lab to what you're doing right now with venture capital. Do you miss the science? Do you miss actually getting to spend time in the lab?
No, I don't. I wish I did. I wish I did. But yeah, I was being a protein chemist at this company. I honestly had one of those moments of if I ever have to set up another SES page gel, I'm just going to stab my eyes out. So there was one of those moments, and a little bit of carpal tunnel, to be honest. Like that definitely was a hindrance for me in my scientific career. But so actually in my last company, I ran an animal research facility, oversaw a medicinal chemistry lab and a wet lab. But frankly, there are just people that are much better at doing that job than I am. So I like to find the talent and let them do what they do best. And frankly, there are a lot better talent than I.
Yeah, I've interviewed a few people as well that are in like business development and things like that have made the same journey. They went from the lab to business development or whatever. And I think it's the same sort of thing. I love the science. I love parts of it, but there are parts of it that I could do without. So I'd like to maybe find something else close, but not quite in the lab.
I get a little nostalgic when I walk by and I smell the acetic acid. I get a little nostalgic. I worked on C. difficile when I was in graduate school, so I don't necessarily miss the smell of C. difficile or poop or anything, but I do have some nostalgia for sure. I used to run a zebrafish facility, and I will say I have a lot of aquariums in my house, and I will not put zebrafish in them. So I'm a little sick of them, to be honest.
Yeah, they breed pretty readily. That's
yes,
one of
they
the reasons
do.
why. As you said at the very intro, you not only work in life sciences, you also are the co-owner of the study. So can you tell us what is the study?
So about 5 years ago, a couple of friends and my husband's a certified sommelier. So he's in the wine industry. He was at the time working on the brokerage side, so representing wines to people at restaurants and bars. But we're talking about, we were a group of introverts, and it was really hard for us to find a place that we wanted to be able to have a quiet glass of wine. And so we decided to make it. So we couldn't find it here. So we decided to make what anyone does, right? Where if you can't find something, you just make a company about it. And so we created the study. It was 5 years ago. And then we were ready to launch in March of 2020. So you can imagine how that went. Perfect timing to open a bar in a pandemic. Do not recommend. 0 out of 5 stars for that one. But it really... in a lot of fairness, it was really interesting for me as an entrepreneur to open up a completely different new concept than drug development. I have to worry about customers and things like that I don't really worry about here. Yelp reviews, right, is something that we don't often have to deal with in the drug development industry. So it was really fun to push my entrepreneurial brain a little bit in that sense and learn different business models and marketing and all that. And then pivoting hard to deal with the pandemic of how do you have a customer facing business deal with the fact that, especially as a microbiologist, I don't want customers right now, right. So stay home, please. But also we have a business. So, I mean, it was really, in a lot of ways, I've learned so much in the past year.
How did you deal with it? In case you missed it. Cheers.
Oh, hooray. Yes. I love it. First and foremost, we went from a bar concept. So we never actually opened up. So I saw the numbers. I said, you know what, we're not going to open up. We're just going to start doing curbside. So we became a wine shop for people that we could help curate packs for them. And then we also transitioned to virtual tastings, which ended up being a really fun thing for us. And just yesterday, we did a wine tasting for a women in bio executive group on the East Coast. Even though we're a wine bar here in Oklahoma, we have this opportunity to have a reach outside of Oklahoma, which has been really fun. And I get to work with my husband, who's a sommelier, and we have a great time doing the virtual tasting. So it was really trying to find, okay, how do we deliver this in-bar experience at home? And a lot of people, myself included, to be honest, is that they're even post the pandemic, there's something really nice about staying home, to be honest. You'll pick and choose what social events you go to. So we will still have virtual tastings and curated packs for you to take home, so you can still experience that. And our business model is completely changed because of that.
I definitely look forward to having a dinner event or something like that. And who knows, maybe we can arrange having a virtual wine tasting to be a part of that in my house, which would be really nice. Because I definitely am a wine consumer, not
same. I don't pretend to know that aspect. And I do, as a microbiologist, understand certain aspects of winemaking. And I've even reviewed winemaking technologies in a former life. But my husband can tell you, like, oh, this is a Cabernet from this region and Napa, whatever. No, it's in my glass and it makes me happy and it tastes good with a steak is where I'm at.
Exactly. So in terms of to go back to the venture capital space for a little bit. So in terms of the venture capital space, what are some of the biggest challenges that your clients face today?
Ooh, great question. So we're an accelerator, but my parent company has a fund. So we're a little bit of a hybrid of both. So we do have access to capital, but we also help these companies raise money. And what's challenging, particularly in the preclinical drug development space, is that there are still some funding gaps in between the grant and the university and the SBIR. And then there's this gap here where accelerators sit, where we don't need to raise $5 to $10 million or 20 to 50 yet. We have some very key experiments that we need to do before we know we can be a big girl company or not. And those really only take $1 to maybe $2 million to do. But a lot of life science investment groups want their minimum investment is $5 million. And that's even a small boutique type kind of firm. Most do 15 plus. So it can be really challenging. We have this to raise less money, frankly, than it is to raise more money. So that's one of the biggest challenges I see now, is trying to fit that little niche of, we have proof of concept, we need to do a little bit more, but we don't need to go raise $10 million quite yet.
Yeah, and it is an interesting sort of challenge, because I find a bit of both. There are a lot of places that focus only on their niche and they don't really look anywhere outside of that. And then there are other areas where they say we only fund at this level and nothing else. I have a very close friend who's working on an eye drug right now, and he's having all sorts of problems trying to find people to fund an eye drug, a glaucoma drug in the United States. He said, look, the only place I can find funding really is in Europe. So it's the only place I can get to be interested in this.
Yeah, it can be really challenging. Yeah, especially if people have their set thing that they love to do, and it's really hard to get them to deviate from that, for sure.
Yeah. And on the other side, I understand it. If you don't understand kind of the ins and outs of that aspect, then why would you want it in your portfolio as well? Because
fair enough,
it's going to be an odd thing to maintain as well.
Yeah, fair enough. I did pitch a skunk odor neutralization technology to a group in France, and they don't have skunks in France. So that was, wait a minute.
Yeah, we have them in Colorado. You definitely
have them here for sure.
Especially as spring comes.
Oh yeah, it's that time.
Yeah. So there are three questions that I like to ask every guest. What inspires you?
That's a wonderful question, and it's a pertinent question for me right now because to be honest, and I'm sure people had these moments in the pandemic of finding inspiration, especially if you never leave your house. I had a series of to-do lists all over my office, and I was still feeling a little lackadaisical about it. And I talked to a colleague of mine, and they're like, "Yeah, because what you have around you is to-do lists, and what you need is inspiration." Oh my gosh, you're completely right. And so I had to think about this, and I had to think about the end goal. And the end goal wasn't, oh, get funding for this company or get a partnership for this program. The end goal was the patient. Yeah. And I cannot believe I completely forgot about that in my quest for checking off a to-do list. And so what I have done is taken the patients for each company of mine and put them on the board in front of me. For my hearing loss company, it's someone who has experienced hearing loss and is deaf, and how to help them. And then we're working on launching a company for Stargard's, which is an inherited form of blindness, and looking, and I literally have a picture of what a Stargard's patient sees, or rather doesn't see. And then this year, I had to put my own brother up there who was diagnosed with cancer this year, of just no. And oncology wasn't a space I particularly wanted to get into, but now I do, because I have that inspiration. I've gone down the path with other companies and technologies that could make money, but I just wasn't into it. And I realized it's because I need to figure out the end customer, which ultimately is the patient, and keep them at the forefront. So what inspires me is the whole reason I got into this, and it was to help people. And it's so easy to lose that message as you're going through your to-do list.
Yeah, I could only imagine. It is hard enough on a day-to-day basis. And then whenever you're not around people, it's hard to just recenter yourself. So good for you for finding that again.
Yeah.
What concerns you?
Say that one more time.
What concerns you?
Concerns me. There's so many, I don't want to get too esoteric about it, but I definitely, as a microbiologist, I'm thinking of the next pandemic for sure. This isn't I always knew I'd lived through a pandemic. I didn't know it was going to be COVID for sure. I really had my money on bird flu, but here we are. But I know that this isn't going to be the last. I also think of antibiotic resistance and this underlying chronic ongoing pandemic that we're going to be faced with, and the fact that we have this lack of funding for that area because the public doesn't have an awareness of it. And that industry isn't necessarily interested in it either. So that concerns me. And I think that kind of leads me to the other concern, is that I feel like there's a real issue in terms of science education and the fact that a lot of people don't know scientists, which is, I mean, for you and me, that's probably all we do now are scientists. For the average, person, they don't really know a scientist, and they probably think of us as being these people wearing lab coats locked in ivory towers. And I think we really as scientists need to go out and communicate what we do and how important it is, so that we're not faced with these fights that we're having, as we've seen in this pandemic, of what comes down to fear, frankly. And the way you get rid of fear is education. And who better to educate than the people that live this every day?
Yeah. Of the people that I know that are immunologists and are studying vaccines and really working in this field of what might the next pandemic be, they probably live a much more terrified life than I will ever know. But at the same time, whenever I interviewed Jacob Glanville, one of the things that he said to me was, look, let's not be all pessimistic about this. We have a pathway forward where we can actually see that we might be able to prevent this from happening. And I love that view. I don't know the nth degree of the science that he would. So, again, it's a little scary, because I think it was in April in Colorado. I remember telling my wife, I was like, oh yeah, sure, they want to shut down all the people that are going back and forth to work, and they want to stop us from going to the office, as if that's going to happen. And here we are. Yeah, most of us are working from home.
And now you probably some of us back to the office, to be honest. So
yeah. What excites you?
What excites me is finding white space. That's a key aspect. Like frankly, and speaking of the first point about oncology, why I never really wanted to go into oncology is I really couldn't find the white space per se. and understanding where I can make a difference. And so to translate that into a broader perspective, I think that's what I've always done, is trying to find that white space of, I feel like if I'm doing what someone else is doing, then that's a problem. And if someone starts doing what I'm doing, then I need to change. And so same thing with the accelerator model. I'm always finding ways to be different. And as other accelerators pop up, great, like we need more people doing this. And so now I got to go find the next gap and where I can fit in. So what excites me is finding where I can be of help, and maybe something I have no idea how to do, open a wine bar. But I know people, I know that I can figure it out somehow, some way.
It's funny. My father passed away in February, and my mom, whenever we were together, I kept just telling her, I don't know this, but we'll figure it out. And then she kept asking me that question. She said, how are you going to figure it out whenever we don't know this? And I just said, look, I have to figure things out on a daily basis anyway. You have to find your way. So we'll find our way and we'll figure this out. And we have. And last night, she used that same exact term on me. And I was like, wait a minute, where did that come from?
Wait.
What are you going to figure out?
But it's so true, because, and here's how you have a wealth and a body of evidence and data that shows you figured it out. You got through it somehow, some way. It didn't look like maybe what you thought it was going to look like, but you made it through somehow, some way. And that's what I always think of when I face an unknown, is I'll figure it out some way.
Dr. Elaine Hamm, thank you so much for spending time with me today. I greatly appreciate it. And thanks for being on the podcast.
Yeah, appreciate it. Yeah, thanks for having me.
Thank you for listening to Life Science Success. For complete details about this podcast, including show notes, how to get in touch with guests, and more episodes, please visit www.lifesciencesuccess.com. If there's someone you'd like for us to invite to the show as a guest, please let me know by sending me a message at the podcast website. Please click subscribe on your favorite podcast app, share the podcast, or tell a friend about it. And last but not least, rate the podcast. Thank you again.